If you're 10 centimeters dilated, should you begin pushing immediately or maybe should we wait? In this video, we're going to be discussing laboring down. What is it? Why would we do it? And different ways that we can do laboring down, which is waiting for pushing once we are 10 centimeters dilated. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be discussing what is laboring down, what does that even mean, and when would we even use it during labor? Laboring down means that you are 10 centimeters dilated, but we're not actively pushing at that time. We're allowing our uterus to passively push our baby down without us having to add anything to it. This is allowing our uterus, specifically the fundus of our uterus, to passively push our baby down further into the pelvis without us having to actively push. This is to decrease our overall active pushing time and conserve our energy. But evidence is conflicting on the risks and benefits of laboring down or not laboring down. The research on laboring down is conflicting, whereas some of the research supports that it can increase your risk of postpartum hemorrhage as well as have some poor outcomes for babies. But there's also some research that supports that it can decrease your overall pushing time and actually have better outcomes for babies and also our pelvic floors. So this becomes really important to discuss the risks and benefits with your providers to decide which one is right for you. It can be helpful during prenatal visits to ask your providers their opinions about laboring down, whether or not they do it or how they would support it in different situations. As a labor and delivery nurse, I fully believe that laboring down is a really great option, but it's not always right for everybody in different situations. These are the different things that I take into consideration when I'm recommending laboring down to any of my patients. Number one, we don't really want to labor down for longer than an hour. There's really not evidence support that laboring down for multiple hours leads to better outcomes, but there is some research that supports that it could lead to poorer outcomes the longer we labor down and baby's not moving further. So if we labor down for an hour and baby did not move down further in the pelvis, likely in those situations we need to actively push to get baby deeper into the pelvis. Second, what is your health status? If you have some sort of infection going on, you have a fever or baby is not tolerating labor, likely not going to recommend laboring down in that situation because we do want to move towards delivery quicker in those situations. If you do not have an epidural, likely laboring down will not be an option because you're going to be actively pushing whenever that urge to push happens. With an epidural, we may not have that strong urge to push like we would with unmedicated birth, or we may not have that increased pressure as baby moves through the pelvis to help us with pushing. So laboring down with epidurals is a lot more common and an easier option to be able to be implemented than with unmedicated birth. And if I do a cervical exam and you are 10 centimeters dilated, I'll always give you the option of trying a practice push, which is where you actively push down with your contractions to see how quickly or fast baby is coming down into the pelvis at that time. If baby moves really well, then I'll give you the option to labor down to see if maybe your uterus will push baby down, or we can go ahead and start pushing to see if maybe baby will just be born a little bit quicker. Taking all of those things into account can be really helpful to decide whether or not you want to try laboring down in this situation or maybe start actively pushing. A really common position that people are put in when we ever think of laboring down is an outlet opener. So we're thinking knees together, feet out, and this is like that internal rotation to open the bottom of the pelvis. If baby is truly in the outlet of your pelvis, we likely should just move towards active pushing because baby is going to be born rather than laboring down in those situations. Depending on the station that baby is in within your pelvis will determine what position is ideal for your situation. If we're trying to get baby to engage into the inlet, we're going to think more wide knees, external rotation, and then maybe tucking the tailbone under. And then if we're doing more mid-pelvis, we're thinking more asymmetrical movements, trying to create more space in the middle portion of our pelvis. So what are those positions? If we're trying to get our baby to engage into our pelvis, we're going to think about opening the top of our pelvis or the inlet. So the wide knee positions, we can either be in a side lying position or even a seated position. If we're side lying, we're going to be either side, whichever side you intuitively pick. Put the peanut ball between your knees and allow your feet to come together. This is opening the top of our pelvis. If you don't want to lay on your side though, or maybe baby doesn't like you laying on your side, you can sit up. And this is, you're at a hospital. Most likely, if you're laboring down in this position, you can change the bed to where it is a chair. When it's a chair, the feet will be a little bit lower than the hips, and we're just relaxing the knees out wide, bringing the feet together. And this is, again, opening that top of the pelvis to allow baby to engage. You can just hang out in this position for around 30 minutes or until you feel a change. If baby's in the mid portion and we're trying to help baby rotate through the middle portion of our pelvis, this is station like -1 to +1. We're going to think about opening asymmetrically within our pelvis. Exaggerated runners is a really great option to labor down in when we're trying to open that middle portion. Having your entire shin on a peanut ball and then the bottom leg is just straight back. You can kind of find whatever position is comfortable for the torso. So you can lay on your side like Gina is. You can bring that bottom arm back and then this top arm forward so your chest is just more towards the ground, or what kind of really just find a comfortable position that you can relax in with your upper body. If you want to do some sort of movement during that position, your partner can come over and grab your shin. When you're having a contraction, they can just rock your shin back and forth. And this is just adding a little bit of movement to allow baby to kind of shimmy through that middle portion of your pelvis a little bit more during laboring down. If you don't want to be laying down on your side and you want to sit up, you can still get that asymmetrical movement with a peanut ball under one of your thighs. And then you can just switch it to the other thigh throughout. So just to recap, laboring down is a really great option if you're 10 centimeters dilated, but your baby is still higher up in your pelvis. Things to consider when talking about laboring down is number one, we don't really want to labor down for longer than an hour. If baby does not move further in that pelvis after an hour, we probably want to add in active pushing at that point. Number two, what is your health status? Can we delay pushing for an hour and it's not going to decline your health as well as baby's health? Number three, what are your preferences? Not everybody wants to labor down. Some people want to start actively pushing right away, and that is your choice. And you can always decide later. So maybe you push for 30 minutes and you're like, maybe I should labor down. You can always change your mind as long as your baby's not like crowning at that point. And last, the position that we choose for laboring down really is dependent on where baby is within the pelvis. We're not going to try to open the bottom of our pelvis if our baby hasn't even engaged into our pelvis. If you enjoyed this video and you want to learn more about childbirth as well as pushing techniques, check out our online childbirth education course where we break down the science of labor and birth. We discuss labor comfort techniques as well as pushing positions, laboring positions, as well as a little bit of postpartum of what to expect. And as a thank you for watching this entire video, you can use code YouTube10 to get 10% off our childbirth education course, or you can bundle our childbirth education course with any of our prenatal fitness options so you can prepare your body for birth and have a strong and pain-free pregnancy.